For the third time, thank you, Voice of God. I'm really indebted to you. So I have the great pleasure to introduce a wonderful senator. But the thing I want to say about Sherrod Brown is that many of you know that in the past couple of years, we have lost in the Congress some of the key giants of health care reform, and that was accelerated at the end of the last Congress. So Senator Harkin, Senator Rockefeller, Congressman Waxman, Congressman Dingell, Congressman Miller, of course, earlier than that, Senator Kennedy. And so a key question is who's going to pick up the mantle with respect to health care in the United States Congress? Well, people don't announce that they're picking up that mantle, but I think our next speaker is probably the likely person who is going to be picking up that mantle. Go ahead. If the Ohio delegation wants to applaud. So anyhow, it is my great pleasure to introduce Senator Sherrod Brown, who graciously rearranged his schedule. He was supposed to speak yesterday morning, but a hearing got called, so he could not come, and he's rearranged his schedule so he could join us for lunch today. Senator Brown is going to be playing the key leadership role in the United States Senate among those in the Democratic Party on CHIP and the Medicaid program, which is characteristic of Senator Brown because he's been a leader and a fighter for so many issues that we would care about, creating good manufacturing jobs, strong advocate for good fair trade, promoting higher education and job training, instrumental in the historic Wall Street reform law, and in the Agriculture Committee advocating for the end of childhood hunger. We got to know Senator Brown when he was in the House, when he served on the Energy and Commerce Committee, on the Health Subcommittee, and he has always been extraordinarily effective. So we're delighted that he could join us today. So please welcome Senator Sherrod Brown.
Ron, thank you. It's a great honor to be here and to be, again, with Families USA and the terrific work you do. Thank you, the Ohioans who are here from the Association of Food Banks, right, and from UCAN, and from the First Congregational Church. And my wife and I were married in a Congregational Church in an all-affirming church, so thank you for that, and Voices for Ohio's Children, and all of you. Thank you so much. Ron Pollock's work has been terrific. I've known Ron 20-plus years. And a little-known fact about Ron Pollock, and some of you know this, but most of you don't, is, you know, Ron grew up in New York, and one of his best friends whom he played stickball with that he says couldn't hit his curveball is Jerry Springer. Did you know that? How many of you knew that? Okay, so it's like one person knew that, but two people knew that. That's true anyway, but so there's nothing more to say about that. But anyway, Ron's leadership and all of you as activists have made such a difference. I mean, you should be so proud of what you have fought for in this country and in this Congress. There's a story Franklin Roosevelt in the early mid-30s met with a group of progressives on, I don't remember what the issue was, and he said, "I agree with you, now go make me do it." And it really is the role of activists to make people of like mind in Congress, people who sort of lean our way in Congress, people who might be indifferent in Congress, but to get all of us to do the right thing. I have since for 15 years, I've worn this pin on my lapel. It's a depiction of a canary in a bird cage. It was given to me by a steel worker at a Workers' Memorial Day rally 15 or so years ago. And you know the story, the mine worker took the canary down in the mine. If the canary died from lack of oxygen or toxic gas, the mine worker got out of the mine. He had no union in those days strong enough 100 years ago, and he had no government that cared enough. And that in those days, baby born in this country, and you know a lot about this, a baby born in this country had a life expectancy of 45 years or so. Today it's two and a half to 3 decades longer, and it's 2.5 to 3 decades longer because of the activism of you and your parents and your grandparents. None of these things happened by themselves, whether it was food safety, mine safety, Social Security, civil rights, women's rights, protections for children, Medicare, Medicaid, safe drinking water, clean air, all of those things, the Affordable Care Act, all of those things happened because of activists, because you pushed, and there's no group, so one guy's clap. The Ohio people know to clap for that. And this group, this Families USA, understands that, I think, as well as any group of activists and the people you represent, the organizations you represent around the country, perhaps better than anyone. For those I've not met, and that's most of you, this is my real voice. I'm not sick. I don't smoke. I just talk this way. And my wife and I were actually at the Democratic Convention a few years ago, and my wife is a Pulitzer Prize winning writer. If you're on Facebook, she's got the best Facebook like ever. Her name is Connie Schultz. And it's, some of you know, yeah, many of you know her writing. But Connie and I were at this event, and it was in a room about a quarter this size, and we were all kind of packed. There were no chairs, and it was we were all kind of packed together. And there was a little stage, and a couple of senators and I went up and spoke and took the microphones. I began to speak. This is a true story. This guy standing right next to Connie, as I start speaking, turned to her and said, "I hate that guy's voice." And she said, "Really?" And he said, "Yeah, when that guy speaks, man, it's like fingernails on a blackboard. I can't stand listening to him." She said, I kind of like his voice. And he said, "You like that voice?" And she said, "Yeah, you know when I really like it?" And she goes like this, and he leans in. She said, "I really like it when he wakes me up in the middle of the night and says, 'I love you, baby.'" So, true story. A year ago at this time, in a colder, snowier place in Washington, I was at Martin Luther King Day celebration in Cleveland 1 year ago, early 2014, and a minister stood up and said something that you all know, but he said it better than anybody I'd ever heard say it. He said, "Your life expectancy is connected to your zip code. Your life expectancy is connected to your zip code." We all know that. If you grow up in our state, my state, if you grow up in the east side of Cleveland, if you grow up in Appalachia versus if you grow up in Shaker Heights, or if you grow up in Scarsdale, New York, you have a better chance in life or a worse chance in life, in terms of everything: quality health care, education, social support necessary to succeed. It's something that most of us know and most of us don't think about, and most of us fail to talk about it very much or to act upon it. 50 years ago, the poverty rate was 26%. Today, it's around 15%. It's still far too high, especially among children. For the first time in our nation's history, 51% of children in schools are now in the free breakfast and free lunch program. Free breakfast or reduced breakfast or lunch program, 51% of students in public schools. That tells us far too much about our country and our inability to share prosperity in this country. We know that as we've dealt with so many of these issues, we know the Affordable Care Act and Medicaid and CHIP, the Earned Income Tax Credit, the Child Tax Credit, we know they work. We know they've made huge differences in people's lives. They've taken people from extreme poverty and brought them up. They've taken people on the edge and brought them out of poverty. They are some of the best partnerships between government and people, I think in many ways, the world's ever known. Despite this, so many people in this town that dress well, that have good titles, that get good salaries, that have good benefits, including health care paid by the taxpayers of the United States. So many people want to cut and undermine and emasculate these programs that clearly work. They want to do that in large part because of their view of government, that government can never work, that government should never be on the side of people in the middle class, or government should never be on the side of people that aspire to the middle class and low-income workers. This fight's been going on a long time. Ralph Waldo Emerson he talked about the innovators and the conservators. He said, history is an ongoing battle between the innovators and the conservators. The conservators, you know who they are. They fundamentally want to preserve privilege and protect wealth. Fundamentally, the conservators want to preserve usually their privilege and usually protect their wealth. The innovators, I would call in 2015 terms of progressives, people that believe in providing opportunity for everybody, not dependent on your zip code, believe in moving forward and helping people have better life, have longer life expectancy and better lifestyles. And we know how hard this fight is. I came across a letter that I'm going to share with you, written, it's dated December 24th, 1936. And to me, it illustrates the difficulty of selling the public, getting the public to buy in, even to the most important things that the public later figures out. This is a letter that a woman in my office, her father found it in his father's, her 90-year-old father found this in his father's papers somewhere in eastern Pennsylvania. It's a letter from the Pennsylvania Gas and Electric Company, December 1936. It reads, on August 14th, it's fellow employee, and it's written by the vice president of the Pennsylvania Gas and Electric Company. And her grandfather was a line worker that was paid a decent salary, but not all that much. On August 14th, 1935, Congress passed the Social Security Act. Under provision of this act, the company is required to deduct 1% of your wage beginning next week, January, 1.5% beginning January 1st, and 2%, and it goes on. And these deductions are designed to provide for your retirement at age 65. So you're this worker, and you get this letter. You've probably never heard of Social Security. It had passed Congress. I'm sure it got attention in the Philadelphia Inquirer and the whatever, but you probably don't know anything about this. And you get a letter saying from your employer, we're going to start taking out money out of your paycheck. We're going to start at 1%. It's going to go up to about 2.5% over the next 4 or 5 years. We're going to send that money off to Washington. And then when you're 65, you're going to get like a pension. And first of all, he looks around, he thinks, nobody in my family's ever lived to be 65. How's this going to work? And why would I trust this to happen? So when you think about anything that we as progressives, and I mean we, I mean you and I and all of us that care about this, anything we do is always difficult because it's always easier to be the innovators, to be the conservators. Hold on, don't change. Keep my privilege, keep my wealth, don't change. It's always easier to be the conservators, to fight progress, to fight what progressives need to do for this country, than it is to be the innovators. It's 1965. So Social Security, we know what people think of it now, but think back what they thought then. 1965, July, 50 years ago this summer, President Johnson signed the Medicare law. People were unsure. Half the country didn't have, the same opponents to the Affordable Care Act, Tea Party, they called it the John Birch Society. Then same people, same group, same strain of sort of misanthropes in our society, not misanthropes, that's unfair, of people that sometimes had, okay, you get it. But in 1965, think about this. When this law passed in 1965, President Johnson dispatched Vice President Humphrey to begin to call mayors and governors in Montgomery and Charleston and Atlanta, Charleston, South Carolina, Atlanta and Charlotte and Jackson and Tupelo and all over the country and said, all over the South, and said, this was 1965, a few months after Selma, the same year as civil voting rights passed, the year after civil rights passed, called these mayors, called these governors and said, if you want Medicare, you're going to integrate your hospitals. If you want Medicare dollars, you're going to integrate your hospitals. Imagine how controversial that was in 1965. So when Social Security passed, it was difficult to implement. It was difficult to get the public to buy in. When Medicare passed, it was difficult. That's why it's so important for a moment to reflect on what we've done. I mean, look at what you've done with the Affordable Care Act. You know what it's meant. These tables know what it's meant to Ohio. 700,000 people have insurance in Ohio. Many, many, many of them children that didn't have it 5 years ago. 100,000 kids under 26 are on their parents' plan. That's just one medium-sized to large state. 1 million seniors in Ohio have gotten free, without copay, without deductibles, free screenings for osteoporosis and diabetes and other kinds of prevention, physicals and all. We know all that, and that's why your work in this made such a difference. Let me tell you, better than the numbers, let me tell you a story. Every Thursday, I have coffee in my office for anyone from Ohio that's in town that I don't always get a chance to talk to one-on-one because of committee hearings and floor sessions. And I was, one morning, and my staff's always there, one morning a woman and her husband and her 2 teenage kids came to see me. They were from Ohio's most conservative corner, southwest Ohio, from the Cincinnati area, and she was lobbying me on the issue of homeschooling, which tells you probably she was, politically probably fairly conservative. That's a judgment, but maybe in all likelihood. And she says to me, we're talking a while about that. Then she says, see my son over there? And she said, thank you for the Affordable Care Act. I said, sure. I said, see my son over there? He's about 20 feet away. She says, he's 15. And she said, he was diagnosed with diabetes when he was 8 or 9, if I recall. And then she said, I tried to get insurance for our family. And she said, I counted the number of times I was turned down. I was turned down 34 times for insurance because of my son's illness, because he had a pre-existing condition. And then she smiled and said, you know what? 2 weeks ago, I signed up for health care, and I have health insurance because of the Affordable Care Act. And again, that's why what Families USA does is so important, that the 700,000 people in my state, as I said, maybe they don't all have a story quite as good as that woman's, but a whole lot of people do. And when you think about what it means in your life, another story real quick. I was in Youngstown one day, and a woman, this was before the Affordable Care Act passed, she said, she put her hand up, and was doing a town hall. It was actually on health care, and she said, I have 2 jobs. She said, I don't have insurance. I'm not making much money. Both jobs are just slightly over the minimum wage. And then she said, she said, I'm 63. I need to stay alive for 1.5 years more until I can get on Medicare. Imagine that. Her goal in life right now is to stay alive so she can get health insurance. Not stay alive so I can see my grandkids but to stay alive. I mean, Margaret Mead said that knowledge and wisdom are passed from grandparent to grandchild. And you know how important, that's one of the really important things of Medicare, is it allows a lot more grandkids to have the joy of their grandchildren and to have the impact on their grandchildren that make for a better world and help teach those kids values. I mean, that's why what we do on all of this is so important in helping people live better lives as a result. And we know what CHIP has done. If we want to tackle inequality in health care, we need to look at extending funding for programs like the Children's Health Insurance Fund. It's reauthorized, but the funding runs out, and we need to do that. Not that this is all about Ohio, but 130,000 people in Ohio, 130,000 children in Ohio have access to health care under CHIP. Many of them would likely not have received health care without it. Again, that's what you have done as activists that care so much about this. It's better access to comprehensive care for these children. It means that a mother actually has the opportunity to take her child with an earache into a doctor instead of waiting till it gets much worse and is much more expensive and may cause the child hearing loss to take him in the emergency room 2 weeks later. It means vaccines and shots. It means dental coverage. It means better treatment when children get sick. It means something we don't talk about enough. It means better attendance at school and a more alert child who can learn better at school. CHIP means all that. It's not just the number of children that are insured under the program. It's the flexibility it provides states. It's the quality of care children receive. I know the Secretary of HHS was here today or yesterday. Okay, and I know that she addressed those, and she is terrific. She comes from West Virginia. She probably talked a little bit about her upbringing and is doing a terrific job. She also, one of her first exposures to public policy was Senator Rockefeller, as Ron intimated, Senator Rockefeller, who retired at the end of the year, and is really the person. I made a floor speech about Jay, who was one of my dearest friends in the Senate, and I sit in the spot on the Senate floor now where he sat, and he really, nobody did more on CHIP than he did, and he had asked me and asked Senator Wyden, then the chair of the Finance Committee, to sort of take up that mantle, and it will be hard to do. He had a lot of years that he worked on this and understood this and fought for this, and was out listening to people about it. And I would, and you know, one of the things that Jay did that not nearly enough politicians do is he used to go meet with, he was on the Veterans Committee, he used to go meet with veterans. I know he did this with children's activists too, but he would go meet with veterans, no media, no staff, and sit with 10 veterans for 2 or 3 hours. I mean, imagine this guy who's a multi-gazillionaire, however much money Jay had or has, and, you know, had every privilege in life, and he would sit and devoted so much of his career to children and to veterans, and would sit for a couple of hours. And I think of Pope Francis, in one of my favorite quotes from any religious leader, said, he exhorted his parish priests a couple of months ago. He said, go out and smell like the flock. Go out and smell like the flock, and how important it is for all of us to really listen to people who have problems, listen to their needs, listen to their concerns. That's what Jay did with children and with veterans, and that's what's so important. And again, it's not just the right thing to do to fund CHIP and at adequate levels. It's also the smart public policy thing to do, because it does matter. It does matter in schools. It does matter in these children growing up as healthy young adults who will contribute to society. It's always been a bipartisan effort. We need to continue to make sure it's a bipartisan effort. That's where you come in. I know that probably many of you in this room consider yourselves Democrats. I know some of you consider yourselves Republicans. And regardless of where you are, where you live, and what you think about who's elected to office in this country, it's so important that you work to make this bipartisan, to help us with Republican members of the Senate and the House, so we can do this right. Let me close with a story from about John Lewis. John Lewis is a congressman from Georgia. How many of you have seen Selma, the movie, so far? Okay. John Lewis was beaten up in the civil rights movement more than any other single person, it's believed. John is in that movie a number of times. John was born in 1940, so he at Selma was 25 years old, and he was and then elected to Congress in the 1980s. He's a personal hero of so many of us. He was was the youngest person to speak at the 1963 March on Washington. A number of people, apparently history tells us, like Father Hesburgh of Notre Dame and others, other civil rights leaders told John to tone down his speech before he spoke, which he decidedly did not do. But he was speaking at a graduation, I believe at Emory last spring, and he told this story about his childhood. He said, these are John Lewis's words, "I saw those signs that said white men, white women, colored women, white waiting room, colored waiting room. I'd come home, I'd ask my mother, my father, my grandparents, why is that? They would say, John, that's the way it is. Don't get in the way. Don't get in trouble." In 1957, he wrote, "I met Rosa Parks. I was 17 years old. In 1958, at the age of 18, I met Martin Luther King Jr. Those two individuals inspired me to get in the way, to make trouble. So I encourage you," he told these graduates, "to find a way to get in the way, find a way to get in trouble, make good, necessary trouble." And that's the calling of all of you, to make good, necessary trouble in your communities, in sometimes challenging people's conscience, and sometimes challenging the power of some people, and sometimes challenging and pushing and talking to your elected officials. Whatever you need to do, continue to do that. And someday in this country, our zip codes, our life expectancy won't be so connected to our zip codes, and you will have continued to make a huge difference for our country. I thank you very much.
I know you got to get out of here.